Today at North Goa District Hospital, we are having a camp for the elderly. Month of October is observed as a month to celebrate the Elderly Day. So today we have called all the senior citizens and elderly people who come to the North Goa District Hospital otherwise in this camp session, so that they don't have to stand in the long queues. And we know that elderly people have chronic issues, chronic problems, and they need care all for themselves some time or the other. So we here, all the medical officers, consultants and all the staff of North Goa District Hospital have decided that today we will take all the issues, complaints, whatever the senior citizens are having under one roof, I shouldn't say, under a small space which is made available over here. And all our consultants, that is of all departments, including medicine, surgery, ENT, ophthalm, psychiatry, then we are giving them diet advice, dietitians advice, Ayush doctors, plus we are doing breast screening for any women who are having any problems. In case these senior citizens have any other issues, then we will be referring them to the respective OPD and fast tracking them, and we would like that they take maximum benefits out of this camp so that we can help them to resolve their issues. And in this way we would like to help the senior citizens and do some good service to the community.
So today we have organized a camp for the elderly because on 1st of October there was a World Elderly Day. And all the elderly people have come. Since 9 o'clock we have started this camp. All departments are there: medicine, surgery, orthopedics, skin, Ayush doctors, ophthalmology, ENT. Everyone has been roped in under one roof, so that all the elderly people who are coming here today and getting the services from the different departments, they should get all the services under one roof. आणि हांगा थंय धावूंक पावना तेंच्यांनी, म्हणून जे कितें आज जे सगळे एल्डरली पेशंट्स हांगा येयल्यात ते सगळे सर्विसीस एकाच एरियेन गावपाचे अंडर वन रूफ. दॅट वॉज द होल आयडिया. And many people have come. Since morning I have seen around 25-30 patients. So good response was there. What we are seeing is, as far as medicine is concerned, majority of the people are having high blood pressure and diabetes. That is the main problem at present that we are facing. High blood pressure, high sugars. High blood pressure, high sugars. So I would like to tell everybody to please check your sugars. Please check the blood pressure. I mean, check केल्या शिवाय कळना. आता समज एक बटाटवडा आसा, तो पळोवन सांगू शकता तो तिखट आसा काय गोड आसा. तो ना, तो खाऊनच कळटलो की बाबा तो तिखट आसा काय गोड आसा. द सेम वे जर आमी प्रेशरूच चॅक करचे ना, शुगरूच चॅक करचे ना, जाल्यार आमकां कळटलें कशें की प्रेशर हाय आसा की लो आसा, नॉर्मल आसा, डायबिटीज कंट्रोलान आसा काय ना तेंय कळचें ना. सो आय रिक्वेस्ट एवरीबडी दॅट वी शूड चॅक the sugars, check the blood pressure of all patients. Now there is a simple protocol that has been formed by the government of Goa, that all patients who are above 18 years of age, whoever comes to hospital, we take the opportunity to check the blood pressure of these patients. And all the people who are above 30, it has been now made mandatory in the hospital that we should check their blood pressures, the sugars at least once a year, so that we come to know where we are. Because the burden of hypertension and diabetes is really high in Goa and in India. So we need to control it. To control it, we to know that this person is having hypertension, diabetes. As far as medications are concerned, for hypertension and diabetes, we have a range of medications which are available free of cost here. The best of medicines are available. For example, diabetes, we have the best of insulins that are available in the market. You name it and we have it. Thanks to our Honorable Health Minister Shri Vishwajit Rani sir. We have Tresiba, we have Rhizodec, we have Novorapid, Actrapid, Mixtard, Novomix, Januvia tablet is available, which is costing almost 45 rupees per tablet. So all these medications are available free of cost. Only thing is the people should come, get themselves checked, and once we know that they are not under control, we can escalate the medications which are available with the medicines that are available here.
हांव डॉक्टर श्वेता गांधी, होमिओपॅथीक फिजिशियन एट नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटल. आयज आमी हांगा इंटरनॅशनल एल्डरली डे सेलिब्रेट करता आनी त्या निमतान आमी हांगा एल्डरली लोकांक कॅम्प ऑर्गनायज केला. जे 40+ लोक आसा तेंच्या खातीर हो कॅम्प स्पेशली ऑर्गनायज केल्या. भरपूर आमी हांगा सगळे कावंटर्स सेटअप केला. मेडिसीन, सर्जरी, ऑर्थो, ENT, स्कीन, सायकॅट्रीक हे आनी प्लस आयुश सुद्दां कावंटर आमी सेटअप केल्लो आसा. आनी स्पेशली एल्डरली लोकांक आमी इवन मेडिसिन्स दितली. जेंकां डायबिटीज म्हण, हायपरटेन्शन म्हण, कसलेय आनीक जेंकां जे त्रास जाता हेज्या खातीर आमी हांगा तेंचो स्पेशल चॅकअप करतली. तेंकां जे इन्वेस्टिगेशन जाय ते बरोवन दितली. तेंचे सगळे शुगर, प्रेशर हे सुद्दां चॅकअप जातले आनी तेंकां मेडिसिनूय मेळटले. आमी आशा करता की ह्या कॅम्पाच्या निमतान तेंकां एल्डरली लोकांक खूब फायदो जातलो ह्या कॅम्पाचो. आनी फुडें अशें आमी आनीक कॅम्प ऑर्गनायज करतले स्पेशली एल्डरली लोकांक तेका आनीक तेजो फायदो जावं म्हणून. Thank you.
I am Dr. Sneha Sose, Junior ENT Surgeon working here at North District Hospital, and I am for the camp which is organized for elderly people. So we all doctors are sitting in an area so that in one area so that elderly people don't have to move all around in the hospital. They don't have to wait in a big queue along with all the other population. So this becomes easier for them to assess the doctor, less queue, plus faster, everything is done faster, and that is for their benefit.
So how long this?
Pardon?
How long this will be?
This will be when now the patients are coming, so it will be continued till the patient.
What is the idea of organizing this?
On World Elderly Day, so this is to celebrate World Elderly Day and to give them honor.
So what is the follow-up for them next?
Follow-up, so as in when required, depends on case to case. Some need not follow up. Only if required, then we ask them to follow up, not unnecessary.
It's a good opportunity for them.
Pardon?
It's a good opportunity for them.
Yeah, it is good opportunity for them. If any of your known persons, any of your grandmother or anyone, grandfathers want to come, they can come now and show us. So it will be done in a faster process for them.
Myself, Dr. Shaheen Sayed. I am a psychiatrist working at North Goa District Hospital, and today's camp is actually for elderly people, and in which all the specialties are together, and we are going to screen all those elderly patients, and if they need any kind of specialized services, we are going to provide them. So it's a good, this initiative is a good thing because many a times we have seen that the senior citizens have to move to different OPDs, they have to wait in the queue, and it becomes very inconvenient for them. So this kind of camp, if it happens frequently, then at one place they will get all the services at a time. So let me tell you about my services. Like in psychiatry for elderly, we usually screen them for the memory issues. We call it as dementia. So there are different dementia like Alzheimer's dementia. In September 21st only we have celebrated World Alzheimer's Day. Then we can screen them for depression, because in old age you get social isolation and so many other medical problems. Loss of the spouse or loss of the loved ones can create some kind of stress or depression in them. So we screen them for depression, then anxiety issues, then sleep problem, then if they have some substance use problem like alcohol or tobacco, so we screen them. So these are the common psychiatric problems we are going to screen our elderly patients. And I think with this camp our objective is to provide them better facilities which they deserve to get from the medical field, and to make them more the services to be provided them in a convenient way, and which help them to come out of their elderly issues in a better way. Thank you.
Yes, my name is Dr. Vaishnavi. I am working here as a junior consultant dermatologist under Bone. So this camp is mainly for elderly people. Elderly people usually they suffer from lot of problems, and even so many skin diseases are prevalent in elderly people like steatotic eczema, chronic paronychia, and most of the time they ignore that, and they take treatment from different practitioners, and at the end they come to skin doctor when all other methods are failed. So most of the time like we get lot of patients, elderly patients, but they don't take treatment properly. So this is to create an awareness also that they can come here for the skin treatment, and some of the medicine they get from here, some they have to buy from outside. But at the end, always skin as such, it's a long-term treatment. It doesn't go in 10 days or 1 month. Certain fungal infection and all, they have to come for 1 or 2 months. So sometimes even if we tell them multiple times you have to do follow all these things, sometimes they don't follow. So I think through this camp we can create an awareness among them that all such things to be followed and all.
So what do you do here in a check-up?
Now I got one patient here. She is an elderly lady with lichen simplex chronicus with secondary infection. So I have given her antibiotic, and later she has to follow up with in our OPD, skin OPD here, OPD number 9.
How beneficial these scans for these people?
Actually, even they come to OPD, we get around 70 patients per day. So among that, few will be elderly, few will be young people. So they have to wait in line. Even though there is something, after each 2 patients, there will be 1 elderly patient is sent inside, they have to wait for a longer time. I think these camps, so that they can come directly, and so that the waiting time is reduced. So most of the time I have seen people, they wait for a longer time. Sometimes they have to take their medication and all those insulin and stuff. So if they don't take food properly, they can't take their medicine properly on time. So I feel these camps will help them so that they can directly come here, take their medication, so their waiting period is very much reduced here. That's what I feel.
My name is Dr. Yoga Eram, and today here there is a camp at Azilo Hospital, especially for the geriatric people, and we are Ayush section, and Ayush means, as you all know, here Ayurvedic come, homeopathy comes, especially in Azilo Hospital, and since I am a homeopathic doctor for geriatric and old people, we usually complaints people comes here is osteoarthritis, then all the vascular diseases like osteoarthritis especially, then diabetes, then all the diseases. We treat almost all diseases, chronic, whatever the chronic cases are there, we treat, and we have all type of medicines. Only there is no proper awareness, and that's why we want to create our awareness for the people today for the camp. Okay.
A lot of people want to follow this Ayush because a lot of
as the question what, now people know after taking allopathic medicines also, I'm not criticizing, but yes, after taking allopathic, some people do get side effects, so and they don't want to continue their medicines, so then the treatment part get cut off. So what I would suggest to the people that don't cut off your treatment with allopathic. If you all are not feeling good in allopathy, come to Ayurveda or come to homeopathy and continue your medicine so that disease get cured right from root. Okay.
Hi, good morning. This is Dr. Shaleen Machado, and today we have organized a camp by Ayush for the elderly, that is a senior citizen. Here we'll be covering up diseases like mostly the common complaints which senior citizens come up are usually rheumatoid arthritis, then they have diabetes, hypertension, even the mental complaints like sometimes depression and all. And mostly if you see nowadays senior citizens, they always face loneliness. So even in terms of that also we cover up, and we can give them support emotionally through even by talking, and even when they share we can give our time also. As they talk also they feel better, because anyways they are lonely, they have no one. So when they speak to us, we give them the comfort and all, and they feel good and relaxed. So we help them through that also. Plus other various things also, even other diseases also like GIT or upper respiratory tracts, all the system-wise diseases. In this camp we are covering up, and even we provide medications based on that, but through our way, that is our homeopathic way, through detailed case taking, depending whether it's acute and chronic. Yeah, thank you.
हांव डॉक्टर दत्तराज नमस्कार, हांव डॉक्टर दत्तराज बुडकुले. हांव नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटलान जनरल सर्जन, सिनियर सर्जन म्हणून वावुरता. आज आमी हांगा एल्डरली डेच्या निमतान कॅम्प ऑर्गनायज केल्लो आसा, जेणे करून हांव सर्जरी पेशंट्स पळयता. सगळ्यांक खबर आसतलेंच, एल्डरली पेशंटांक खुबश्यो सर्जिकल डिसिजीस जाता. अल्सर म्हण नाका, डायबिटीक फूट, हर्निया, चडशे जाणट्यांक जाता, मोर देन 60 इयर्स लोकांक जाता. असल्या पेशंटांक जे कोण हांगा कॅम्पाक आमच्या येतले तांकां आमी स्क्रीन करता. गरज पडल्यार इन्वेस्टिगेशन्स, ब्लड चॅकींग करता आनी गरज पडली जाल्यार तांकां ऑपरेशन करून फुडले तांचो प्रोसिजर आसा तो आमी फुडले करतले. थँक्यू.
I am Dr. Walden, junior orthopedic consultant here at Asilo, North Goa District Hospital. I would like to thank Dr. Vandana Dume, the MS, for organizing such a wonderful event, and all the doctors here gathered here. We are very privileged to know old people as our friends, acquaintances, and loved ones. They are fonts of wisdom, of experience, and of storytelling for us here today. They can share their experiences and help us persevere or tell us of possible pitfalls here. That is why we are having this camp today for International Elderly People Day, to build awareness and to help people, old age people, to live their life out with dignity. In orthopedics, we deal with a lot of patients with joint pains and if at all back pain, other joint pains, and we can get a lot of tests done with such camps and give them medicines which are available free of cost here at North Goa District Hospital. So it is a very, very helpful camp for all these people.
नॉर्थ गोवा डिस्ट्रिक्ट हॉस्पिटलान आज आमी इंटरनॅशनल डे ऑफ एल्डरली मनयतात आनी ताज्या खातीर आमी हांगा रेजिस्ट्रेशन करपाक बसल्या. हांगा खूब सिनियर सिटीजन्स आयिल्ले आसा आनी प्रत्येक डॉक्टर हांगा तांच्या खातीर स्पेशली तांचो ट्रिटमेंट करपा खातीर बसल्या आनी आतां ऑलमोस्ट 75 पेशंट्स जाल्या आनी ह्या फुडें बी येतले आनी आमी तांची आतां सेवा करपाक बसल्या हांगा.
Hi, my name is Dr. Rachita Alvi. I am Ayush MO.
Hello, myself, Dr. Rashid Gawaz.
Okay, so we conduct eye press screening in a hospital every day from 9 to 1. So today, as for elderly camp, we are conducting for all the senior citizens. It is important to get ourselves tested as the cases have increased. Breast cancer cases have increased. Many patients we find like fibroadenoma. So we provide this service for all patients from about 25 years. And you all can come to our hospital and to avail these services at any time from 9 to 1 every day.
Yeah, so like what is it
Okay, since this test is only conducted for women, the cases of fibroadenoma, CA breast have increased, and women have no time to give time to their for self-examination. Most of them are not aware. Many of them are housewives. All of them are not literate. So we try to conduct for everybody, try to spread awareness so that more and more patients can take the services. Today's importance for being an elderly day, since patients mostly don't come. Elders they require support to come. So we have taken this initiative for them. We try to scan most of the patients, elders. Most of the time what happens is that old age people, they are not aware of all the new technologies, things about their own health. So we are trying to promote more and more.
Most of the humans actually they don't get time for themselves to come and waste the time in the hospital for especially for breast screening. And this is very important that we should check our breast, and they should take care of themselves. And when we detected the lumps, we have our surgery OPD here. Whenever there is a positive case, we get them checked in the surgery OPD. From there, they can do the further treatment. And here in Asilo Hospital, we got a nice feedback also that all doctors are supporting very well.
So after getting a positive case, the main thing in patient's mind is regarding the fear that what if the case gets to the extreme? What if we are detected with breast cancer? What if there is something which we can't treat?
But when we refer to the surgery OPD, all the doctors are very supportive. They guide you in the right treatment. They follow the right protocol. And if it can be treated in our hospital, we try our best to keep the patient with us and give her all the treatment. And if it is out of our hands, then we try to send the patient to the GMC hospital for further treatment.
My name Dr. Preeti Toraskar, intern. So today at North Goa District Hospital, they have arranged the camp for on the occasion of the National Elderly Day. So here we do all kind of checkups, like there are medicine department, then ortho, then all other departments are here. So here we check everything like BP, sugar and everything for these sugar levels and all, everything they check here.
What is your section here?
I am presently sitting in the surgery but actually I am here intern as posted.
My name is Ankita and I am intern here, homeopathic intern. And today the camp is on occasion of International World Elderly Day. So it's for screening of elderly people. We have ortho, optal, ENT and Ayush, dietitian and psychiatry of this camp.
What time it is now?
It is from 9 a.m. till 1 p.m.
So what is this idea like to have?
It's for the screening of elderly people.
So what's the follow-up after?
They will get follow-up in the respective OPDs after this.
हांव पेडण्या तालुक्यासून हसापूर गांव थंयच्यान येयलो आनी हांव तपासपाक म्हणून येयलो 12 नंबराचेर. जाल्यार हांगासर पयल्या जाणट्यांक कॅम्प दवरला. ते आयज आमकां बरें पडलां, नाजाल्यार थंय गर्दी जाताली. त्या दिसा येयलो तेन्ना केतल्यांक म्हाका दिसता एकाच्या भायर गेलो. आयज आमची बेगीन मोकळी जाली आनी सगळे तपासून म्हाजे 12 नंबराचो दोतोर मेळ्ळो. परत म्हाज्या पोटान दुखता तोय म्हाका मेळ्ळो. आतां म्हाका तेणी एक्सरे काडूंक सांगला. मग आमची सोय हांगासर आयज बरी जाली. आनी आमकां हांगासर आज नाश्ता बी दिला. ते परत मेळ्ळा म्हाका नाश्ता, ते खाल्ले हांवें. कित्याक चड टायम जालो म्हणून दिला म्हाका तेंच्यांनी. आनी गरिबांक बी अशे थोडे नाश्ताय कितें मेळ्ळे, बरें फायदो पडलो. कित्याक आयज आनी सकयल मोकळी जाली न्हू आमची, बरी जालें न्हू. पयलें सगळें हांवें केलें म्हाका 8चे आहा ते केले. पण म्हाज्या पोटान दुखता. म्हाज्या क्रिकेट बॉल बसला पोटान. ते म्हाका आतां हें करूंक सांगलें, सोनोग्राफी करूंक सांगलें. हे बरोवन दिलां. पोटान दुखता म्हणजे 4 दीस जाले म्हणजे पोटान दुखता. बॉल पडला वयल्यान येयलोच पडलो बॉल. आतां कितें करतलो? आतां बरें पडलें न्हू म्हाका. हे आतां सोनोग्राफी करपाक वयता. आतां डेट घेवंक सांगलें. आतां तशें बरें आसा.